With the number of ageing populations increasing worldwide, dementia is fast becoming a critical healthcare issue. Mentis Cura is a technology company that's developed a groundbreaking neuro-diagnostic aid that helps to identify physiological evidence for the diagnosis and progression of dementia. We sent our reporter Nick Wallace to Reykjavik in Iceland to find out more.
Iceland is well known for its wild and rugged topography. Although sparsely populated, the quality of life here is good, and as in most countries, people are living longer. Just outside of Reykjavik, in a national park filled with freezing lakes and bubbling springs, I met Ivar Meyvindsson, Global Head of Development at Mentis Cura, a company at the forefront of dementia diagnosis.
Icelanders are very resilient people. So farmers and fishermen that have been out in every type of weather doing their job. So it's a natural place to look at and study health in old age. And the inspiration for Mentis Cura has been to try and find more economical, more easy to use ways to monitor the brain as we age, and to help doctors more easily find the most appropriate care and support for people that are suffering from dementia.
Using electroencephalography, or EEG, Mentis Cura have developed a unique neurodiagnostic aid called Sigla, which can quickly and painlessly help provide an accurate early diagnosis of dementia. It can also distinguish between dementias, indicating, for example, Alzheimer's or Lewy body dementia.
Making an EEG recording and generating a Sigla report takes less than 5 minutes in total. It's both cost-effective and convenient.
Working collaboratively with clinicians at Landspítali University Hospital in Reykjavik, Mentis Cura spent 8 years building a sophisticated database of EEG measurements taken from the brains of more than 3,000 people. Sigla has been used in clinical practice since 2013.
Sigla EEG, it is helpful in pinpointing the diagnosis, that you are then certain that it's correct, or you can get the result that it's not a dementing disorder, and that is of course also very helpful.
Sigla is designed to work with standard EEG readers, and the simplicity of the whole process makes it easily accessible for clinicians and their patients. Creating a stress-free environment for people who may have dementia makes all the difference.
This is like coming into a person's home, you know. My mother sits in a nice chair, have those EEG electrodes on her, and she doesn't even know it's a test. I am with her the whole time, which is very important. The other tests, like the memory questionnaires, the MRI, you know, then I had to say goodbye to her. She went alone with a clinical person, and I felt that, you know, she was stressed. She was more stressed going through that procedure compared to this one. This is a nice one, I would say.
Mentis Cura have partnered with clinicians and pharmaceutical clients for trials all over the world.
Clinical trials in Alzheimer's disease and other dementias are extremely challenging. Sigla can really help make those trials more effective and help to use those valuable resources more efficiently. And we believe in the future it can also help identify those patients that can benefit from specific therapies.
The accuracy of distinguishing Lewy body dementia from Alzheimer's disease using EEG recordings is thought to be over 80%. When Sigla results are used in combination with current clinical best practice methods for diagnosing dementia, that rises to around 90%.
I am very proud that this software is developed here in Iceland because I know that it can really make a difference in the diagnostic and treatment, hopefully, of the Alzheimer's disease.